After weeks of warnings, this North London hospital became the first to experience a COVID-19 emergency. Northwick Park yesterday declared a critical incident as it ran out of beds in intensive care. In a letter seen by ITV News, the chief nurse said, "We have this evening declared a critical incident in relation to our critical care capacity at Northwick Park Hospital. This is due to an increasing number of patients with COVID-19. This means we currently do not have enough space for patients requiring critical care." The NHS Trust, which runs Northwick Park, tonight said the incident had been stood down. The Prime Minister sounded exasperated when asked if the crisis had been underestimated.
It's perfectly obvious when you look at the gradient of the disease that we have a real threat now to our country, to the ability of our NHS to manage it. And unless we get this right, we are going to see thousands of lives lost, as I say, needlessly.
A nurse who works at Northwick Park put this image on Facebook showing her and colleagues wearing clinical waste bags on their heads because their protective equipment, or PPE, still hasn't arrived. She asked to remain anonymous.
When we stay there like in a bay for 4 patients, looking after them, taking all their medications, giving it to them, sometimes we almost stay there for 1 hour and 30 minutes. I know it's not really safe for us, but then we have to do something because of the shortage of PPE.
Retired nurse Mary-Louise Holdsworth accepts this is an emergency without parallel. She's answering the government's plea to go back to work.
We've experienced epidemics before, like the swine flu and other things, but nothing on this scale, nothing that has the potential to increase the way this is likely to do. And we know that the NHS, as it is at the moment, is not going to be able to cope with the demand.
Italy's been warning that their nightmare will be replicated if Britain fails to act quickly enough. Hospitals in the capital are now starting to experience just how devastating that could be. Juliet Bremner, ITV News.